Hey, so we are recording. Good morning. Good morning. Good morning.
Good
Happy
morning.
Friday.
Morning.
Happy Friday of week 3. Hard to believe we're at the end of week 3. I am just waiting for a couple more students to come in. Kylie, I'm sending you a message. You and 2 of your classmates are going to stay after class today. Liliana and Kylie and I think Jamisha. You guys are going to stay after with me, okay? I sent you all a message in the chat. Um, how is everybody?
I'm doing good.
Okay. I think just missing one student. Go ahead and
Hi,
start.
good morning.
Hey, good morning. How are you?
Good,
Excellent.
good, good.
Good, good, good. Okay, if everybody could come on camera, that'd be great.
Yeah, because I turn on my phone.
Clarence, I can't see you. Just looking at your ceiling. Clarence, are you there? Still can't see you.
Yeah, I'm here. I'm just getting my charger for my laptop.
Oh, okay. So, um, how is everybody today? I'm in snowy Colorado. Snowed overnight again. It's freezing out. So, for all of you, let's see, for all of you in the nice, nice weather, oh, enjoy it. Oh, okay. So today we're gonna do quiz 2.
Okay.
There's our student. Um, we're gonna do quiz 2 here at the beginning, and we're gonna review it. Part of reviewing quiz 2, we'll go over a lot of the content of this week, and then we'll look at the content of what we haven't covered. All right. And then after that, we're going to do a case study, short case study, where I'm going to break you out into 3 breakout rooms and um, um, there's 3 questions to answer, and each room will answer a question. Then we'll come back and talk about that. Okay.
Mhm.
The case study, for your information, is in your week 3. If you haven't had a chance to review it, it's in your week 3 announcement that I sent out last weekend. It's at the bottom under your blueprint notes. So between now and the time we do the case study, if you could pull that up, because you'll need that when you go into the breakout room. So that's where it's located. Announcement 3, below the blueprint notes at the bottom. Okay. Any questions so far? How are things going in this class? Okay. You have one recording. You have one recording for exam 1 review from last weekend from Professor Ford. I sent that to you last Sunday. Okay. You have that. And then I'm doing a review after this class at, I think it would be 11 o'clock Eastern time. So I'm doing my exam review. And then Professor Kershaw does hers Sunday at 6 p.m. So hope to have the recording to you Sunday night. So those will be your 3 exam recordings. Okay. What else? No questions?
Professor, you said we have to pull out that blueprint for the case study. So what are we gonna do this one?
So if you go into your week 3 assignment, or week 3 announcement, at the bottom, there were 2 attachments.
Yes.
One with the blueprint notes for this week, and then underneath that, it said case study.
Yeah, I already
I
opened
just
it.
need you to open it. That's all. I just need somebody
all right.
somebody to have it open so you can see what the case study is and what question you're answering.
Okay.
Okay?
All right.
Okay, just a couple of things. Let's see, Clarence, I need to see you on camera before we start the quiz. There you go. Thank you. So let's see, it's 9:05. Let's take till 9:25. Is that 15 minutes? 25 minus 5. No, 9:20. We'll go to 9:20 and then we'll review the quiz. So your quiz 2 is open, and it should be open also for my Monday students who are here today. Should still be open. So everybody go ahead and start quiz 2. You need to be on camera for the whole time. Okay? And Celine, I can only see your forehead. If you could pull your camera down a little bit. There you go. Thank you. Thank you. Thank you. So go ahead and start quiz 2.
Professor, can you put me in a breakout room? Mm.
Hi there.
Just like automatically shut off. That's why I wanted to let you know. I charged it, but I'm gonna try to start it again. I don't know what happened. It just turned off.
Okay. Is it charged?
Yes, I did charge it.
Okay, I'm gonna
That's
put you
weird.
back into the main room. Just communicate with me on the chat. So I need
Okay,
to
I
watch
just wanted to
everybody else.
let you know. It's like beeping. Let me see. Screen just flashed. Let me just try to do this again, but
Okay, just communicate with me in the chat, okay?
okay, thank you.
Mm-hmm. Don't forget to hit submit. I have several that haven't submitted yet. So if you haven't finished, or if you finished, got to hit submit. I have 2 students. It looks like 2 or 3 students still working. Anybody working on it, just raise your hand. Everybody done? Okay, let me double check. Hang on. Okay, great. Okay, let's review the quiz. How was it for you?
Hard.
Hard?
Not hard, but it was more difficult than the last one.
It was what?
It was more difficult than the last one.
Oh, okay,
I agree.
okay. Did you guys take a minute to do the readings, the 4 readings in the
Yes.
module, and do the blueprint readings?
Yeah.
Okay, okay. Well, let's go through it. If everybody can come back on camera, that'd be great. Let's see. Skylar, are you there? There you are. Okay. All right. Everybody see my screen? Yes, no?
Yes.
Okay, thank you.
Yes.
Okay, all right. So this week we're talking about migrants, migrant farm worker, rural populations, homelessness, and poverty. So these questions are a little bit of a mix of all of them, but let's go through them. So in your preparation for learning about the rural community, so which should the home health nurse anticipate about clients in the very rural community? What do we know about the rural community? What are the
There's
correct
a lack
answers?
of like education or
Pardon me?
I'm sorry, somebody else was talking.
No, go ahead.
There's a lack of education. There's a lack of resource to medical care, basically.
Well, think about it. Think about a rural community, kind of out in the middle of nowhere, right? Think of the limited resources there are going to be, right? So A is correct, right? They're much more likely to have environmental chemical exposures. What kind of chemical exposures are we talking about?
Pesticides.
Pesticide exposure, right? You read that in your readings. So they're much more likely to have exposures to chemical pesticides. The other correct answer was D, right? They're more likely to have complex chronic illnesses. Why?
Because
we-
the lack of healthcare means that they're not getting their primary and secondary
Mhm.
like preventions in as much as people that live in a busy area.
Right. Remember that the rural population really doesn't focus on their preventative, even primary and secondary, right? They don't see primary preventative care as important. Okay. And they don't follow up on their screenings. Okay. For whatever reason. They don't think it's important. Maybe they lack transportation. Maybe they have a job that is an hourly or daily paying job. And if they leave to go drive a couple hours, they won't get paid for the day, right? So they're much more, so by the time we see them in clinics or urgent cares, their conditions or diseases are much more advanced, right? So they are more likely to have complex chronic illnesses. Okay, one of
I
the
have a question.
oh, go ahead.
Okay, so we went over week 3 content for week 3 for quiz 2. with no, so basically, we we take quiz 2, but going over week 3 content today after you go over the quiz from week 3 content for the quiz. Do you understand what I'm saying?
I don't.
So are you going over week 3 content today?
We're doing week 3 content, reviewing the
Today.
quiz, and after, right.
Right, so we have a quiz over things that you haven't went over in class yet.
Well, remember what the purpose of the quiz is. What's the purpose of the quizzes?
That's I'm just asking you. So basically, you're going over things that you haven't went over in class.
Well, the expectation, hang on, Brandy. The expectation is that you have done the preparation for class, because the quiz is made up of questions that the quiz is made up of information that's in your readings. This week they were in the modules, and your weekly notes. So the intention of the quiz is to see how well we're prepared for class. So thank you for the question. So going back to one of the largest population in rural health is chronic illnesses. So that's why D is correct. Okay, we know B, it's the opposite, right? They won't have adequate access to physicians, because what happens in the rural community? Who's available?
Usually you have to drive for doctor's appointments because there's not one in your town.
Right, you may have one primary care physician in your town that has no specialties. Pediatrics, OB, neurology, cardiology, right? So there isn't adequate access to physicians and specialty physicians. And then we know C, most of them will not have employer provided insurance, correct? They just don't. Okay, a lot of their like I said, a lot of their jobs are day jobs where they get paid by the day. They don't have insurance that covers medical, dental, and health, medical, dental, and vision, retirement, vacation days. They just don't have it. Some might, but most don't. Okay. Any questions about that? Question 1. Question 2. Nurses developing a tertiary prevention program for members of the rural community. Which intervention is appropriate? So let's review. What is primary prevention? What is primary
Immunizations.
interventions? What is primary?
Immunizations and like
Education and immunization.
yeah.
What are we trying to
Preventing
do?
And preventing the
Prevent.
illness.
Prevention, right? Primary is P for primary, P for prevention. We're trying to prevent something before it even happens.
See, this one had me
Se-
confused.
Pardon me?
This one had me confused. I was confused on
as
the first
well.
one and the second one. Because I was like, and
Me
provide
too.
information. I was thinking after provide information, after they have already, got a disease. And then A, I don't know, I was confused on that one.
I was the same way because both of them
Me too.
kind of implied education. And I was like, okay, well, if it's education, then that's the last step. And if that's the last step, I looked at for which thing, and I was like diabetes or pesticide exposure. And I felt like pesticide exposure pertained more to a rural community than diabetes related foot care. So that's why I chose that one.
Yeah,
Okay.
I don't know though.
Okay.
Like it would be
Okay.
helpful to maybe review the content before the quiz. I mean, but everybody teaches different.
Pardon me, Brandy?
I said I think it would be helpful for most people for us to review the content beforehand instead of afterhand. I mean, even though we did read the content, I have never been in a class where we're going over week 3. We having a quiz before you go over the lesson. no class on campus that I have ever taken has ever done that.
Mhm. Well, I reviewed in our week 1 orientation PowerPoint, the quiz slide, which said the quizzes were going to be given at the beginning of class for that particular week. So, I don't know what to say about that. A couple of things about primary, secondary, and tertiary, going back to question 2. Primary is prevention, secondary is screening, and tertiary is treatment or management. They already have to have something. Okay. The one thing also to remember about these 3 intervention levels is that education is not just at the primary level. Education is at all 3 levels. So you can't use education as an indicator. Okay. Education at the primary level is educating to prevent. So maybe we're teaching about pesticide exposure. Okay, minimizing the risks of pesticide exposure. Maybe we're teaching kids about bike safety and we're talking about helmet safety. Maybe we're teaching kids about obesity prevention, teaching older kids about substance abuse prevention. Okay, that's education at the primary level. We're teaching to prevent. Secondary is, let's say we've identified a person or a group of people that are at risk through screenings. Okay. We then educate on how to reverse that course so it doesn't become tertiary. So let's say I'll take my school nursing experience. Let's say we identify a group of kids that is at high risk for obesity. What are we going to educate them about? How to reverse that course, the risks of obesity, long-term health risks, right? So education is at the secondary level, trying to reverse the course. And then let's assume they have something, disease, condition, had an injury. We are then educating at the tertiary level is to help them manage whatever's going on. Right? So let's say, hang on, Megan, let's say they have diabetes. Let's say the kids in the school, a few kids have diabetes. They have diabetes. They want to learn how to do their own blood sugars. So the education is the nurse teaching the student how to do their own blood sugars. So there's education at every level. Don't just make the assumption that the education is at the primary level. Okay, so those are the few things I want to clarify about primary, secondary, tertiary. Well, A is clearly in this question the correct answer here because they already have diabetes, right? You're educating on diabetic foot care, right? What is B? B's primary, right? We're providing education on minimizing excessive pesticide exposure. It doesn't say they have pesticides that they've been exposed. We're providing information on minimizing. So we're trying to prevent something before it happens.
So to clarify, you're saying that the T1 is for if they already have
Tertiary, they
disease
have to have something.
okay.
They have
And
to have
then
something going on.
For prevention, it's if they don't have it, but you're still able to educate them.
Well, just think of prevention. We're trying to prevent something before it happens by educating.
So if a question asks for prevention and
Uh-huh.
it says provide information, is it usually prevention, like primary? If it says provide information on
Well, what
you know.
well, what if it said provide information on diabetes related foot care?
I understand where I messed up now, and I might be able to help other people understand too.
Okay.
I had picked the provide information on the pesticide exposure because of where it's at, but the key word is minimizing excessive pesticide exposure in that one. And the key word for the top answer is diabetes related foot care, implying that they've already got diabetes. But
Oh, okay.
the second half of that is not implying that they already had pesticide exposure. It's like a flyer you would put out before it even happens kind of situation. You know what I mean? So it's
Exactly.
not the
Exactly.
first words that we have to look at. It's the end product that we have to look at.
Well,
It's
you have to
not
look at,
educate, provide, encourage. You're supposed to do that through the whole spectrum. It's the end part that you have to look at your keywords.
well, let me add to that. You also have to look at the beginning part. The beginning part of that is provide information. Okay. It doesn't say, if it said, provide information to migrant farm workers who have been exposed to pesticides. That would be tertiary, right? The question is saying they've been exposed, right? This is saying that we're trying to provide them information to prevent or to minimize the risk of pesticide exposure.
Yeah, I understand that.
Okay. What about C? What's C?
That's secondary.
Secondary.
Screening. Anytime you see the word screening, it's always secondary. Screening is early identification, early intervention. Okay. And what
Can you-
about D? Oh, go ahead.
So P is preventions, S is secondary, and then the T is for teaching, or is that for treatment?
Treatment.
Okay.
Teaching happens at all three levels. P is prevention. Primary is prevention. Secondary is screening. Tertiary is treatment.
For example, some teaching in the tertiary level.
Right. So let's look at this here. Educate families on diabetes related care. So they have diabetes and you're still educating them on how to.
I got it.
Right?
Yes.
All three levels are education. Whether you're educating to prevent, educating to reverse the course, secondary, educating to help them manage or treat their disease, tertiary. Okay? Celine, make sense?
Yes, I got it.
Question 3. Migrant farm worker presents to the migrant outreach clinic complaining of numerous things: abdominal pain, nausea, vomiting, diarrhea, skin rashes, eye irritation, throat irritation, difficulty concentrating. Okay, so without even looking at the question yet, what are these symptoms of?
The chemicals symptoms for farmer workers.
Yeah, pesticide exposure. In your weekly notes for this week, there was a section on page 2 under migrant farm worker that I highlighted for you. And the topic was pesticide exposure. And I highlighted what's the difference between acute and chronic pesticide exposure. Did you all see that?
Yes.
Okay. So what are these symptoms of? Well, number one, you have a migrant, right? So we know it's talking about
stomach pain,
Pardon
red
me?
eyes, red
Pesticide
eyes.
exposure.
Right. So what's the right answer here?
Ask the farm worker if they apply chemical pesticides.
Exactly. These are your classic symptoms of a pesticide exposure. Okay. Since we don't diagnose, we wouldn't request a physician's order for an antihistamine because we're not even sure what it is. That's A. Right. These are not the signs and symptoms of tuberculosis. So B would be incorrect. We wouldn't complete a TB symptom screening. And then this certainly raises above the level of conjunctivitis. So that's why D isn't correct. So C is the correct answer. Okay. Anybody have any questions about that? Okay, during a home visit, the nurse notes the migrant farm worker is living in a small house with several other families. Which nursing assessment is a priority? What are some important cues in this question? There's several.
Living in a small house with several
Small house, several
That they're
families,
farm workers.
farm workers, and what's the other one? What's the key word?
Priority.
Priority. This is a question that is it's a priority question. So what's the answer here? What we know we have a
TB.
migrant, we know we have closed small house with several other families. From your readings, what is this potentially a risk for?
Tuberculosis.
TB. So what's your answer?
A.
Yeah. Okay. A is the correct answer. The risk factors: migrant family living in a house with several other families. Priority would be the TB screening.
I went
Okay.
between A and D
Okay.
because I looked at it as the several families, but then I ended up going back to the TB because of the frame workers. But now that you put it in the sense of priority,
So
I should have looked at it that way.
Skylar, you bring up a good point, and I'm going to review this. Here's a good test taking strategy, guys. Okay. If you come upon a question like this, I'm going to use Skylar. Skylar came upon this question. Okay. There were two answers to Skylar that looked correct. Okay. And it's not a select all that apply. Right? So only one answer is correct. So Skylar or anybody, you then need to go back and reread the question. What did you miss? All right. So if you come on a question, it's not select all that apply. There's more than one answer that looks to be correct. Go back and read the question. All right. So hopefully what Skylar picked up was priority. It's not that D couldn't potentially be correct, but it's asking what is the priority. And here the priority was a TB screen. Does that make sense?
Yeah.
And that's why I always encourage students in their exams to use the highlighter. Use the highlighter in ExamSoft and highlight any words or cues or phrases that stick out so that when you go back to reread the question, you have highlighted those important aspects of the question. Okay. The other thing I suggest with exams is using that line where you can cross out wrong answers. That helps to knock off some answers so that when you go back to review it a second time, maybe you're only looking at 2 answers to choose from versus 4. Okay. Okay, this is a poverty question. Comes from our poverty section. Which statement reflects the impact of income on health outcomes? Just think, before you even, here's another test take. Before you even look at the answers, see if you can come up with an answer in your head first. And then go back and look at your answers and see if one is close to that. So just by looking at the question, what would you think? What the impact of income on health outcomes? Just in general, what would you think? Would you think that lower income individuals or families that live in poverty have better health outcomes or poorer health outcomes? What would you think overall?
Horror.
Okay. So then we start looking for an answer that reflects what we're thinking about the overall question. So do we think that obviously the correct answer, there's several correct answers. Let's look at A. Low income increases the risk of chronic illness. Does that make sense? Yes. Okay. Low income reduces the attendance at wellness visits. That makes sense? Yes. Okay, so if B we know is correct, then we can cross out C. That's an incorrect answer. And then D, low income does not improve health outcomes. Is that true? Yeah. So the correct answers are A, B, and D. Does anybody have any questions about this question? Does it make sense? And we'll talk about poverty more when we get to our content after the quiz. What should the nurse anticipate for a family living below the federally defined poverty line? Okay, so just think about it in general. What would you expect? I'm asking you guys. What would you expect for families living below the federally defined poverty line, which is living in poverty? What kinds of things would you expect?
More sickness.
Poor health outcomes.
Poor health outcomes, more sickness, yes.
More limitations to access to.
Yeah.
And increased vulnerability due to the lack of employer provided insurance and
Exactly.
fewer community resources.
Yeah, exactly. Exactly. So just think out loud before you look at the answers. Well, if this is a family living below the poverty line, what are going to be the increased risks? They're going to have poor health outcomes compared to those living above the poverty line. That's obvious, right? So that makes B automatically an incorrect answer, right? Because it's not unchanged. It is changed, right? Megan said increased vulnerability due to lack of employer provided insurance. Living in poverty, you have the risk of being either uninsured or underinsured. And then increased vulnerability due to fewer community resources. Question 7, which client is at the highest risk for adverse health outcomes related to poverty? So here, what's important in the question? What do you need
Saying
to pull
it's
out?
the highest risk. So the
Highest.
priority patient.
Yeah. So who's at highest risk?
See, I was confused on this one. I was
Okay.
stuck
I
between the
was too.
15 I was stuck
It's-
between the 15-month-old and the 68-year-old. I knew it was a 15-month-old, but I don't know.
Same.
I picked the 68-year-old because I was like, they have diabetes and they're
Okay.
older, so I was like, I don't know.
But
And
what's the
15-month-old
higher risk for the
says no medical
15-month-old?
history.
Right,
The
no medical history.
15-month-old can't
See,
advocate or provide for itself though, so that one's the highest risk because
Yeah.
not only is it living in poverty, but it's required to depend on somebody else to set anything up for them or
Wait, Megan, what did you
provide
say?
anything for them.
Megan, can you repeat the
I said
beginning?
I said the 15-month-old is most at risk because out of everybody else in here, they're old enough to talk for themselves and to provide for themselves to some extent. They can pick up a phone and make a phone call or drive. But a 15-month-old can do nothing for itself. It's reliant on a parent to be able to provide those things and doesn't have a choice
That's
in the
part of
matter.
it.
Like we have to stand up and advocate for that.
That's part of that. That's good. Thank you. That's part of it. We know that children living in poverty are most at risk. Okay. Then add to the age of the child is no medical history. Do we know that they've been immunized? Do we know that there were any issues at birth?
No.
Okay. We need some kind of a history. So without a medical history, that puts that 15-month-old at much higher risk. We don't have a history. Okay, so it's not that the 68-year-old female with type 2 diabetes is not potentially at risk, but why would that be the highest risk? I mean, why would that be at the highest? Why would that be higher risk than a 15-month-old without a medical history? For those of you that answered D, what were you thinking?
See, I completely disregarded the no medical history. To me, in my brain, that had nothing to do with it. That didn't seem like a worry to me for some
Oh,
reason. But
okay.
now that everyone is explaining it, it makes sense to why that would be the higher risk. But for me, I looked at it as the person is older, they have diabetes, and most of the time when they're in poverty, like insulin's expensive. So they're not going to adhere to what they're supposed to be doing. So I thought they were more at risk than a baby that couldn't advocate for themselves. But I should have looked at the medical history being the big red flag.
Right, right. And remember, here's another test taking tip. And Skylar, you did this when you said, well, insulin, they can't afford, they might not be able to afford insulin, so that might, but that's not in the answer. You're adding information in there that's not there.
Yeah, I tend to read way
Okay.
too much into
Okay.
questions.
Well,
So
that's gonna be a problem. So who said anything about insulin? Right? Right. Okay, so 15-month-old, always remember that if you're asked any kind of priority question about risk, poverty, living in poverty, not living in poverty, the child, it always has the highest risk. All right? The child is highest risk simply by their age. Okay? Question 8. Which would the school nurse expect for an impoverished adolescent? Correct answer is what?
Pregnancy.
C. Increased risk of unintended pregnancy. Right? Look at the other answers. They're the opposite. They have an increased risk of dropping out of school. Right? Remember, we're talking about an impoverished adolescent. There's not going to be improved attendance to extracurricular activities. They're going to be decreased attendance. And this group will not have a good use of adaptive coping mechanisms. They're going to have that will be challenging for them. Okay, does everybody understand why C is correct? Okay, which client is at the highest risk for homelessness? What's the important word here? Highest. Okay, it's a priority question. What's the correct answer?
C.
Nope.
Veteran.
What? It's asking for the high.
It's the
This is
veteran.
this is a good example of all these answers look like. We know that a child with older child with suicide ideations may be at risk. Somebody with schizophrenia may be at risk. Substance abuse may be at risk for homelessness, but who is the highest risk?
The
veteran.
the veteran.
Why?
Veteran.
Well,
Because
why?
they don't have
Because
any
they're
They're
support.
alone. There's
they're
no support
alone.
system, and they have post-traumatic stress disorder.
Right, right,
Yeah, I saw traumatic on there, so.
right. So the importance here is living alone.
Yeah, no
Right?
support.
Look at all the other answers. Child suicidal ideations in therapy. Somebody they're checking in with somebody. The schizophrenia are living in a group home setting. They're checking in with somebody. Somebody's there with them. Adolescent with substance abuse and supportive family, somebody's there. Okay, but the veteran with PTSD is living alone. There's nobody to check in with or to help facilitate resources. Does that make sense?
Yes.
So again, another question, highest. Not to say everybody's not at risk, but who has the highest risk? Last question, the nurse is working with a homeless population. What might she observe?
All of it.
All of
All
them.
of them.
All of them. All of them. How did everybody do in this question?
Good.
All of
I
them.
missed the last one
Okay.
because I thought I couldn't, it just didn't feel right to click all of them. So I left out chronic and I shouldn't have.
Okay, so another test taking tip with your select all that apply questions, do not be afraid to select all. Don't be afraid to select all. Okay? And actually, homeless population, chronic diseases is a major, major issue. So don't be afraid to select all. Okay? Okay, let me pull up. Let's go through our content and see what we didn't cover. Okay, so I'm just pulling up your notes now. This is what you received. Okay, what more do we know about migrant farm workers? They're seasonal, right? They're seasonal. They come and go. They move around. There's a lot of issues with that. Okay, there may be language barriers. There may be transportation barriers. They typically don't come with private vehicles. They typically don't speak the language. It's hard for them to understand what's available to them. They may end up living in crowded housing conditions. Very likely, actually. They may not seek out any kind of health care because number one, they don't understand the language, but number two, they don't understand what the provider might be telling them, or how are they going to communicate to the provider what's going on. The other another factor with migrants is they usually travel in families, so you have kids involved, which presents a whole new set of issues. Okay, the kids working on the farms, and they do. Okay, kids are much more at risk to adverse effects of pesticide exposure, much more at risk of the effects of heat and cold exposure. Social issues, they've been taken out of school, so their academics has been paused. They're usually sicker, ear infections, respiratory infections, injuries. Okay. We know that migrants have much higher risks of chronic diseases. Okay. Obesity, diabetes, mental health issues, substance abuse issues, obesity. And as we talked about, the kids that are at risk for malnutrition, infectious diseases, dental issues, immunization issues. This came up in one of your questions. Farm workers have the following health risks. The biggest risk they have is pesticide exposure, which is why I've highlighted this. You need to understand the difference between an acute exposure and a chronic exposure. Acute, you had a question about that. And we went through all the signs and symptoms, but chronic. Remember, if people are working on the farms for longer chronic years, they're going to be exposed to more chronic symptoms, birth defects, cancer, blood disorders, neurological problems, maybe reproductive issues, much more at risk for Parkinson's or Parkinson's-like symptoms. Okay, so you are going to get a question. about acute versus chronic. All right, so make sure, that's why I have this highlighted. Make sure you understand the differences. If somebody was coming to your clinic, would you be able to recognize the difference between acute exposure and what may be chronic symptoms? Okay. What is rural? Anybody have any experience with rural populations or rural communities? If you have family members that live in rural communities. Okay, it's like living in a remote farm or village or small town compared to a large metropolitan area. Lots of risks. Okay, a lot of them are similar to the migrant farm workers, but there are some differences. Typically, the population is younger than 18, older than 65. Rural populations tend to have residents that have lower or reduced amount of years of formal education. Okay, the estimate is nearly 25% of rural Americans live in poverty. And that translates into the estimate of 40% of rural children live in poverty. Okay, this was part of a quiz question. Fewer residents have insurance or adequate insurance. Much more high-risk occupations in the rural community. We talked about this in one of the questions. Rural adults are much less likely to prioritize their health care, in particular, prevention. They're more likely to smoke, more likely to have chronic diseases, obesity, more likely to not take their screening seriously. So by the time we see them, they're usually at the tertiary level. They have something. Less likely to seek medical care, less likely to have insurance. Rural populations also have a higher infant mortality and morbidity rate, right? Especially in areas with poor physician coverage. What if you have a high-risk pregnancy? And the only doc in town is a family physician that doesn't have OB experience or OB specialty. You're having to travel for that care. We know that rural residents have a much higher levels of substance abuse and mental health illnesses. Okay. And rural population, like the migrant farm workers, a lot of these areas that they live in are agriculture. So they too have a high risk of pesticide exposures. Okay, so again, a lot of similarities because a lot of the migrant farm workers are working in the rural communities, which a lot of it's agriculture and forestry or mining. Okay. Then homeless and poverty. Lump that together in your notes here. We know that poverty is defined by the federal government annually. They set what the poverty guidelines are. Okay, when we talk about poverty, we talk about the definition is the inability. Living in poverty means there are insufficient resources to meet your family's needs. We talk about the 4 basic needs. We have food, shelter, I've highlighted it for you, food, shelter, transportation, and healthcare. Okay, what contributes to poverty? What do you think? I'm asking you guys, what contributes to poverty?
Unemployment.
Not having a job.
Unemployment. Yep. What else?
Mental health illness.
Mental health.
Substance abuse.
Substance abuse. Absolutely.
Their family dynamic.
Absolutely. That's a big one. Family dynamics.
The number of family members or children in the home.
Uh-huh. And your inability to provide. Absolutely.
Disability.
Disability. Absolutely.
Lack of support system.
Good one. And then what kinds of issues do we see of individuals, families living in poverty? What do we see?
Malnutrition.
Malnutrition,
Increased risk of illnesses.
big increase risk of illnesses, especially chronic illnesses. Higher
Substance abuse.
substance abuse, mental health issues, more difficulty with pregnancies, increased infant morbidity and mortality, maybe higher risk of hospitalizations, ER visits, lack of insurance, maybe living in a community that doesn't have quality education opportunities. Maybe living in a community that doesn't have big, huge grocery stores, so you're limited on the nutritious foods you can select. Maybe you live in a community that is high with violence, high with high with crime activity. Okay. We know that we just talked about this, young children. This is really important to know. Okay. And this is where that age factor comes in. When talking about poverty, young kids are at the highest risk of effects of poverty. Young kids. It's not that the elderly is not. Okay. But look here, highest risk. So if it's asking about highest risk kids, I said that covering the quiz. Kids who live in poverty, lack of access to adequate nutrition, poor brain development, increased exposure to toxins, trauma, abuse, more chronic issues with the kids, maybe growth and development issues, developmental delays. Okay. Homelessness. What might lead to homelessness? Everybody has a story. I always ask students to think, every one of our communities right now, everywhere we live right now, each one of us have homeless living in our communities. Do we not? Let's say you were asked to spend a day on the streets with your homeless population. How would you approach them? What would that look like? How would you establish a dialogue? What might you do? I'm going off your readings. This was all covered in your readings. What are one of the first things we need to do in working with the homeless population?
Like
Gain their
screenings,
trust.
just
Trust. Who said trust?
Or I did.
Okay. Whoever said trust, that's where we start. Most people don't want to be homeless. Most people are humiliated, embarrassed, whatever. If you are out there on the streets working with this group, you've got to establish some kind of trust, right? You want them to be able, especially the families, the homeless families. You want these parents or moms or parents to be able to trust that you can help them find the resources they need, help that you can assess the level of where they're at. Okay, so therapeutic communication, trust, most important to develop initially, right? Let them tell their story without being judgmental. Okay, what kinds of issues may people find themselves in a homeless situation? Loss of job. What else?
Foreclosure.
Mhm. Disability. Does anybody ever work?
Divorce.
Divorce? Anybody ever work with the homeless population?
Sort of, kind of. When I did peer support specialist classes, I worked with a place up in Maryland, and I mean, we dealt with mental health and substance abuse mostly, but a lot of that is the homeless population. So I did have several people that were homeless.
Mhm. It's very challenging, very emotional. You kind of have to check your own feelings at the door, of what your perceptions are, or you have any biases during this for this population. You really have to check, especially, the families. We saw a lot during COVID, a lot of financial struggles and people, whatever, losing their homes, moving in with family members, moving into shelters. It's everywhere and it's increasing. Okay, so we need to respect the individuality of every person, right? Many factors we know contribute to homelessness. Okay, and one of the you got this in a quiz question, but one of the biggest issues, one of the most important critical issues that you'll see with homeless is first and foremost their mental health issues and their substance abuse. Remember that. Okay, there's lots of issues you'll observe, but most of all, what you're going to observe most frequently is mental health and substance abuse issues.
Absolutely.
Okay, so up here, it's easy to stereotype, but we're often going to be wrong, right? And stereotyping is going to ruin that chance of maybe an effective, trusting, therapeutic relationship. Right? We can't make assumptions, let them tell their story, learn who they are and how they got there. Right? That way you can help guide them to what they actually need, what resources they need. Okay. Here's some examples from all these 4 groups we covered this week. And let's go through this of primary, secondary, and prevention. So think of all the groups: migrants, rural, homeless, poverty. Primary prevention: teach ways to avoid pesticide exposure. We all understand why that's primary?
What are you doing?
Advocate for childhood immunizations for the migrant farm worker children. Primary. Advocate for better living conditions of rural migrant farm workers, right? To try and help prevent overcrowded living conditions that put them at higher risk for TB. Do you understand why those 3 are all primary? We're trying to prevent something before it happens.
Yes.
Okay. Secondary, screening. So maybe we're screening for financial instability. Maybe we're screening, especially those with chronic health conditions. Maybe we're doing yearly blood pressure, A1Cs, blood glucose screening. And here's the education: educating on the importance to keep your screenings, your cancer screenings, your pap smears, your colonoscopies. That's where your education piece comes in. Okay. Tertiary, they have to have something. So maybe we're providing guidance on non-pharmacological management of lower back pain, helping a homeless client find and apply for resources. They're homeless, right? They have an issue going on. Maybe referring to the health department for treatment of STDs and HIV. So they have a diagnosis. We're referring them to the health department. Teaching a client how to take their medications. Maybe educating on side effects. They're taking medications for a reason. They have something. Right? Does everybody, do you understand those examples? Okay. Okay, just doing a quick check-in. How's everybody doing? I'm going to break you out into, we have 15 minutes left of class. I'm going to break you out into your 3 breakout rooms to do the case study. So somebody in the group has to have the case study pulled up. I told you at the beginning of class where to find it. And then there's 3 questions. Breakout room 1 will answer question 1. Breakout 2, number 2, breakout 3, number 3. This is a case study about migrants, the migrant and rural population. So I think it will reinforce what we just went over. Does anybody have any questions about the content we just went over? between the content we just went over and all the information we talked about covering the quizzes, you should have a much better understanding of these 4 groups. Right, so let me break you out into breakout rooms. And then we'll spend maybe, I'll check in with the groups, maybe less than 10 minutes on the case study. So I have it pulled up, and then we'll come back and you guys will tell us what the answers are and why. And then I will send you, when I send you a recording of this class today, I'm also going to send you the case study with the detail in it. Has the right answer and the rationale. So if you want to go back and review it. Students requested that early in the week, so I sent that out. Okay? All right. Let me get you into breakout rooms. What did I not do here? Recreate. Okay, I'm going to open the room, so you got to join them. So Megan, did you get your invite to join?
Serves a large Hispanic population with many migrant farm workers who are primarily male. The town Ms. Garcia serves is approximately 45 miles from the nearest. See, this is
you guys figure it out? Okay, great.
Yeah.
Awesome. Everybody come up with their answers, all the groups?
Yeah.
Yes.
Just wait for everybody to come back in. Everybody? Okay, got a few more. Was that helpful? Case study?
It is helpful. Yeah.
Yeah, just reinforces. And then next week is an exam, and then the following week we're gonna do, let's see, I sent you out an email about all that. Let's see, in week 5, we'll be covering week 4 and week 5 content. So remember, the next quiz, it's in that email, just to reiterate, the next quiz, which is quiz 3, we'll be given that in week 5 after the exam. And what does that cover?
Week
Four.
4 and 5.
Weeks 4 and 5. And instead of doing a case study that week, we're going to do a Kahoots that week. Okay. All right. So let's pull up the case study. Okay. Here we go. Okay. Group 1. What did you come up with? Room 1. What did you come up with?
We chose C.
Yep. C is the correct answer. Think about working out in the rural community. Right? You may be the only one out there. Right? You don't have locked. Think about working in the hospital. Think about all the resources you have near you. You have anybody to ask things to, right? If you're a community nurse working out in the rural community, you're it. You're it. Okay, so professional isolation, limited opportunities for continuing education, maybe lack of other kinds of health personnel working alongside you, right? Heavy workloads. You may be the school nurse, you may be the clinic nurse, you may be the immunization nurse, you may be the pediatric nurse. So if you're working in a rural community, you have to have all your tools in your toolbox, right? Because you might be working with elderly all the way down to kids, right? One of the big issues in the rural community is lack of anonymity. Okay, what happens in the rural community with regards to lack of anonymity? Everybody knows you, right? There's no privacy.
This may be stupid, but what does anonymity mean?
Anonymity means
Let's see.
there's no privacy. Anonymous.
Okay.
Anonymous. There's no privacy in the rules. Everybody, everybody. And that's another big issue too, just so you know, for patients. A lot of times they won't seek care in the rural community because it's a very tight-knit community. And if you go to the urgent care with abuse, neglect, domestic violence, substance, mental health, they're afraid everybody's going to know your business the next morning. So they really are reluctant to go and get care. So that's the anonymity on the actual client's population. Okay. Number 2. Room 2, what'd you come up with? Room 2?
We choose number D.
D?
D.
You chose D.
Yes.
Okay,
That last
great.
one.
Yep, that's the right answer. And again, I'm going to send this case study out to you with the recording so that if you want to go back and review the answers and the rationale, this is my guideline. So I'll be sending this out to you. So yes, D is correct. This question required that you be familiar with the culture of the Mexican community, right? And you're right. Right? Mexican clients may appear to understand information by nodding, but if you read the rationale, how do you really assess if they understood? Okay. So this rationale goes through lots of different characteristics about the Hispanic community. And the reason why the Hispanics are chosen in this case study is because, well, why? Why? Because that makes up the bulk of the population of the migrants, right? Okay. So the nurse is considered an authority figure that should respect the individual. You have to be able to know about the culture, try and maintain openness and dignity. And then here's information about the Mexican population. Prefer polite, non-confrontational relationships with others. Right? They may appear to understand what you're saying by nodding, but they may also fail to understand what you're even saying. Okay, so how do you take measures to validate their understanding? Okay, Mexican individuals expect to talk about personal matters, kind of chit chat in the first few minutes. They expect the nurse not to appear rushed and to be a good listener. This is part of their culture. Humor is appreciated. Touching as a caring gesture is seen as a positive behavior. So when you're working, and we'll get into this later in the term, but when you're working with different cultures, right, there is an expectation that you have an understanding about different cultural values, beliefs, practices. What if you don't? What do you do? If you don't have an understanding, what do you do? You ask, right? Clients are very willing to talk about their culture and their beliefs and their practices and, you know, their food preferences. Okay. Okay, room C. What did you choose?
C, D, and E.
Oh, great. All correct answers. Okay. Physical demands of crop picking, right? Obviously take a toll on their neck, back, may have chronic pain. Okay. Once again, another example, they're exposed to chemicals, pesticides, right? And then skin cancer, maybe a long-term symptom or chronic exposure. Okay. So good. You guys did really good. Really good. Proud of you. Okay. As I promised, since we don't take a break, we're done 10 minutes early, which is right now. So I don't want to hold you. I hope a couple things. I hope everybody has a nice weekend. Number two, if anybody has any questions, stay on and I'll answer them. I have 3 Monday students staying on. Otherwise, you know how to reach me. If you'll be taking the exam next Friday morning at this time, if at any point during next week, after you've finished either attending reviews live, watching the recordings, doing your preparation for the exam, okay, if at any point in time you still need help with some concepts that you're struggling with, doing this 12 concepts, reach out to me next week and we'll schedule a Zoom, okay, and review whatever you're struggling with. All right, please take advantage of that. Okay, we all want to do well in this exam one. Okay,
And you said what time is the review today?
I'm doing it in half an hour.
Okay, and it's the same Zoom?
Yeah. I have to finish up with some other students for about 15 minutes and then need to get off and get back on. So
When will your recording be up?
this afternoon.
Okay.
Yeah, as soon as I get it. My computer's going to be running a bit slow today because I'll have to upload the recording of this class as
Alright.
well. So it'll be a little bit. But you'll get it. You'll have it by mid-afternoon. Okay? All right. I'm going to stop recording here. Everybody else who